Hello and welcome to our nursing theory presentation. Today we will be talking about Nola Pender's health promotion, and people that will be presenting today is me, Mackenzie Myers, Olivia Ware, and Kristen Williamson. We will be talking about Nola Pender and her backstory, her life. We'll be talking about her actual nursing theory, which is health promotion, and then we will also be talking about our personal beliefs, like what we think about her theory and do we think if it's okay or what we agree, what we disagree with it, and then we'll talk about applying the actual theory, and then we'll also be doing a conclusion and have a references page.
Okay, so I'm going to talk a little bit about Nola Pender and her background. So she got her bachelor and master's degree from Michigan State University. She then went to Northwestern University where she got her PhD. She has published countless texts and journals, including 6 editions of the textbook Health Promotion and Nursing Practice. She also developed a program called Girls on the Move, which was used to promote physically active lifestyle among adolescents. She was a nurse educator for years. She taught students who were obtaining their bachelor degree, master's, and PhD students. She's received many awards and honors over her lifetime. A couple of these include the Lifetime Achievement Award by the Midwest Nursing Research Society, the Honorary Doctorate of Science degree at Widener University, and she was also selected for Portraits of Excellence, which kind of labeled her as a nursing theorist and premier scholar. So she was involved with many organizations. She was the co-founder of the Midwest Nursing Research Society, the president of the American Academy of Nursing, and a member of the board of directors for Research America. She developed her the health promotion model after seeing professionals only intervening after patients have already developed acute or chronic health problems. So we'll talk about that more in the next slide. Okay, so I'm going to talk a little bit about.
Hello, and my name is Mackenzie, and I'm going to be talking about Nola Pender's health promotion, her model. The health promotion model notes that each person has a unique personal characteristics and experiences that affect subsequent actions. The set of variables for behavioral specific knowledge and effect have important motivational significance. These variables can be modified through nursing actions. Health promoting behavior is the desired behavior outcome and is the endpoint in the health promotion model. Health promoting behavior should result in improved health, enhanced functional ability, and better quality of life at all developmental stages, so all times through life, from infant to death. The final behavioral demand is also influenced by the immediate competing demand and preferences, which can derail intended health-promoting action. Nola Pender's health promotion model theory was published originally around 1982, and then it was later improved in 1996 and also in 2002. It has been used for nursing research, education, and practice. Applying this nursing theory and body of knowledge that has been collected through observation and research, nurses are in top profession to enable people to improve their well-being with self-care and positive health behaviors. The health promotion model was designed to be a complementary counterpart to models of health protection. It develops to incorporate behaviors for improving health and applies across the lifespan. So like I said earlier, across all developmental stages, so across the lifespan. Its purpose is to help nurses know and understand the major determinants of health behaviors as a foundation for behavioral counseling to promote well-being and healthy lifestyles. Pender's health promotion model defines health as a positive, dynamic state, not merely the absence of disease. Health promotion is directed at increasing a client's level of well-being. It describes the multidimensional nature of persons as they interact within the environment to pursue health. The model focuses on the specific three areas: individual characteristics and experiences, behavior-specific cognitions and affect, and behavior outcomes. Health promotion is defined as behavior motivated by the desire to increase well-being and actualize human health potential. It is an approach to wellness. On the other hand, health protection or illness prevention is described as behavior-motivated desire to actively avoid illness, detect it early, or maintain functioning with illness constraint. Individual characteristics and experience. So this is prior to related behavior and personal factors. Behavior-specific cognitions and affect. These are perceived benefits from action, perceived barriers to action, perceived self-efficacy, activity-related effect, interpersonal influences, and situational influence. Behavior outcomes, commitment to a plan of action, immediate competing demands and differences and preferences, and health promoting behavior. So this is basically everything that her nursing theory talks about. It talks a lot about, obviously, health promotion because it's called health promotion. But yeah, all right.
Okay, so I'm going to talk about how my personal philosophy of nursing kind of compares.
All right. So I'm just going to be talking about, kind of what I think about her nursing theory. Necessarily, I mean, I do agree with her theory. Like, I'm not going to say that I just think it's completely wrong because that's definitely not true. Like, I do think that promoting people's health is something that that's like one of the main things that nurses do, but she really doesn't talk about, like actually deeply caring for the person, like not just being like, hey, we need to promote your health because that's obviously something that nurses do. That's a big part about it. I do like how she talks about like you need to individualize. That's a good thing. And then I like how when she talks about environment, she talks about that's like what people like are dealing with like in their daily life. So I like that aspect of it. I just really don't believe that nursing is just promoting health, even though that's a big thing we do. We care for patients, we're like emotional support systems at some point. So that's basically kind of what I think about it. But overall, I mean, I did like this theory. I didn't think it was bad. I didn't disagree like completely. I agree with everything she said. I just didn't like. I wish that she would have put more stuff. So I guess I would say I agreed mainly. I just wish I could change some things. Just change, how it was just kind of not very broad. It was just simple and just saying, oh, they just promote their health. So that's the main thing that I really don't agree with or whatever. But I do like how she did individualize. Say you need to individualize, like when you're promoting health, because sometimes people can't reach other, goals, promoting goals that other people can, because they don't have the resources. Um, you know. All right.
Okay, so I'm going to talk about how my personal philosophy of nursing kind of compares to Nola Pinder's philosophy of nursing and the similarities and differences I see there. So, her whole theory or model kind of revolves around the idea of nurses having the obligation to promote healthy lifestyles and behaviors to prevent future problems or preventing problems from occurring. I talked about that in my first slide, why that's her reasoning behind it. And I think that that's 100% an obligation of nurses, because if you're promoting healthy behaviors for people, then they won't have problems, or hopefully won't have problems in the future. She also defines environment as being both physical, interpersonal, and economic. And I talked a lot about that in my personal philosophy, and I really do believe that there's much more to the environment than just the physical space you're in. It's also the mental space you're in. And if you understand that, it kind of helps you understand why people make the choices that they do, why they act certain ways, and why they do and don't do stuff. So I think in my personal philosophy, I really I believe that nurses should combine compassion and knowledge, and doing that will allow for the best patient outcome. So, and it has some similarities to her idea, because if you have this knowledge of what's healthy and you're able to promote good behaviors that you know, and combining that with compassion and understanding for their environment, and combining that together will have a good outcome for the patient, because you have the knowledge of what's healthy. You're combining that with compassion because you care for them being healthy and not having future problems. So I think that there's definitely some similarities there, and I think that her health promotion model is very important. I think that's what every nurse should do: promote healthy behavior to prevent future problems.
For Nola Pinder's health promotion model, what do I think about it? I do agree with Nola Pinder's health promotion model. I think that the view on each concept and like how they're explained works together pretty great to help others understand more about what nursing is as a whole and how exactly it works within the healthcare system. And all the like little pieces, sometimes they need to be explained, like the person, like the environment, and all of that good stuff. What I like about her health promotion model is that it brings light to the role of a nurse and helps everyone else understand how much nurses actually do help in the promotion of health today. So it just shows how nursing works really by explaining each concept and kind of explaining them in a way that you can understand it if you are an outsider. Would I change anything? If I had to change anything about her health promotion, I would most likely be more specific about health and environment, because now, since she has made this health promotion model, mental health has really come a long way, and it's become a big part in health, which it should have always been, but recently it's started to become like more of a part in mental health. So for your environment, that could really be affected by mental health, because say it's not you with the mental health issues, but someone you live with or someone you're around all the time has really bad like mental health issues, may have disorder, may have something going on, and you're seeing that every day, that's going to affect you mentally, and you're going to have to figure out how to live with that as well, not just them. And then for like the health concept, it's not just your body. Speaking of health, your mental health can affect that a lot. Like, your mental health can affect a lot of different things to do with your body. So if your mental health is a problem, that's also something we would need to fix and make advances for to change, because just like a broken leg is going to affect you, your mental health can affect different systems in your body. So that is the only thing I would change, but for the most part, I do agree with her health promotion, and I think it's a good thing.
When we talk about applying Nola Pinder's nursing theory to like the clinical setting, mainly all we do is, try to help people to prevent illness and promote their health. So like we could give them ideas of things that can help them. Like if they have something like diabetes, and we can be like, this is the type of diet that you need to have, and like this is what you shouldn't eat or whatever. And basically that's like the main thing that I kind of got from her model, is that really you're just trying to promote their health by telling them things that they can do that will in turn promote their health. I know it sounds very repetitive because I feel like hers was very repetitive. So basically, you just have to tell people what they can do. Like, say if somebody had chickenpox when they're younger, you need to be like, well, you might want to get the shingles vaccine in case you get shingles for when you're older. So, I mean, that's one way you could do it. You could, just give people things that can overall improve their health, like telling them they need to diet, not diet, but have a healthy diet, healthy lifestyle. They need to quit smoking or quit drinking. They need to obviously get vaccinations. Basically, just things like that. That's what I kind of got from it. That what you would do when you're in a clinical setting using her model. And basically, she was also saying that each person is individual. So there's going to be some things that you're going to say overall to everybody. Like you're going to tell everybody to eat healthy and all that mess. But you're also going to have to come up with things that will promote their health, like for the specific individual. Like, so, if somebody has some certain illness or whatever, you're going to come up with something that can help their illness and something that they can do and that they're able to do, and like a goals and stuff that are actually reachable, like people can actually do.
Okay, so to conclude this PowerPoint, I'm going to kind of go back over the high points that we touched on. I'm going to start with the contributions of Nola Pender and her health promotion model. As we've learned, this health promotion model is all about health promotion to prevent future problems. So I think it's really important for nurses and future nurses to think about this and know that you really do have an obligation to promote healthy behavior so you don't have future problems. We also all went over our personal philosophies and kind of where they stand with hers and what we think about Nola Pender's philosophy and, kind of the comparison between the two. So to end this, I'm going to reiterate the importance of applying this to real world. Her health promotion model should be applied to real world because if you prevent the problems, then they won't happen, or they hopefully won't happen. So I hope y'all learned a lot from this.
This page is the references that we use for the PowerPoint and presentation. And this is the end of our presentation on Nola Pender's health promotion. We hope you learned a lot, and thanks for watching it.